removed all the debridement, the foot, sole of the foot looked like this. I advised for amputation, but since they have a lot of money, they wanted that this should be preserved. So it took full 5 months to do this, okay? So the point is that you should take care. Prevention is better than cure, rather than undergoing such things and then correct it. Second is neuropathy. What they talk about sensory neuropathy. Pain and tingling sensation in multiple areas of the foot skin and decreased sensitivity to cold and heat. And if you put a sharp or pin or they will feel very less pain. So we just touch the hot water and burn it out. So it is advised, there is a hot water while you're taking bath. If you want to feel the temperature, don't put your foot inside the water. Put your elbow joint in the water so that you can feel it whether it is too hot. Otherwise, foot will burn, okay? Then autonomic neuropathy. Disturbance in the functioning of sweat glands and glands responsible for keeping
may I request Dr. Shastri to be on the dais? He was supposed to chair. No, please.
Okay, come, Dr. Shastri, come. What happens? Because when skin gets dried, sebum is less, sweat glands are not working properly, then it develops cracks. And cracks leads to infection. And what happens? AV shunt, they open up. And what happens that blood supply is also, it looks red. Foot will look red, but less is blood supply. Arterial supply is very less. So how can you recognize? You lift the foot, it becomes pale. Once it's down, it will become red. So don't confuse with that. So because very susceptible to this trauma, infection and developing of gangrene, ulcer, there is no time left. Very rapidly it will develop in a diabetes. And if you know that a diabetes person, how will you know that infection is there? Because there will be this thing, very bad smelling socks. So he can understand that. So, and another thing, diabetic patients, they are old patients, they sit for long hours. So that leads to venous congestion in the feet. And because since decreased neuroinflammatory response in diabetics, so they develop this kind of cellulitis. It is very, very common. You will find your relatives, they are having this kind of feet. And this is because sometimes you have to take incision, longitudinal incision to take out the pus. And see that this is an X-ray. See how we say that calcification is there in the arteries, fat deposition. See, well calcified artery, okay? You see, on X-ray. See, this is a forearm. You can radial artery is calcified. Now, after this, it starts depositing like this, narrowing starts. See, this total block, femoral segment. See, this is the picture in the infrapopliteal region. See how narrowing, blocking and all this. This is the typical picture of a diabetic person. And sometimes diabetic persons come with the backache. We think that there is some vertebral problem or this is a aortoiliac junction narrowing. This leads to buttock claudication. Sometimes backache, they confuse it with the backache. See, diabetics, they keep on smoking, and see this fellow was a colonel in army. First he lost this feet, he continued to smoke, then he lost this. It was done amputation in Chandigarh and then it was done by me. See, these are all patients who are coming to our OPD. This is a foot of an income tax commissioner, lady commissioner, and see how she was neglecting it. So this is the narrowing. If you do the angiogram, you will find narrowing, and then we treat this either by endovascular treatment. You can see we can to increase the flow. That is very important. See. Then role of bypass surgery in diabetic foot is very important. So we do dorsalis pedis arterial bypass, posterior tibial arterial bypass, important in ulcer in on heels, femoropopliteal arterial bypass. See this I have used the vein, posterior tibial artery joined to the popliteal artery, see that on good flow, okay? So this is to preserve the, prevent the foot undergoing amputation. So these are the various bypass grafts, they are available to do this. See this femoropopliteal for junction. See this fellow had some problem, kidney problem, so many problems. So we stenting was not, it was discussed. So we did the femoral popliteal bypass and femoral bypass and then femoropopliteal bypass. It's still working after 1 year. You see this. So, these are the, as I advise, that the pressure ulcers. So we do the back dressing and take at least 3-4 months to make it heal. Very regular watch, follow up, and all this. Person get healing. Pneumatic foot walker we use, and these are the special shoes for diabetes. So to prevent to protect it from attack of neuropathy, attack of vascularity, and some important tips for saving lips. Always advise daily morning walk, tobacco abstinence, smoking, no alcohol, of course red wine sometimes, avoid being overweight, and the most important thing, never walk barefooted. Use soft tissues and cotton socks. Keep your feet clean and dry. That is very important, because after bath, within the toe, take a towel, clean it, and then apply, take some surgical spirit and rub it so that toe spaces, they remain clean. Otherwise, that is a very source of infection. Or do not ignore blisters, cracks, and cuts and feet. Consult immediately a vascular surgeon. Avoid prolonged sitting for more than 1 hour. After 1 hour, get up and walk for 10 minutes, and then sit again. Venous congestion in a limb of a diabetic will lead to cellulitis. That I think most of the physicians, they don't understand why there's a redness, sudden redness. Arteries are working well, but why sudden redness? Because of venous congestion leading to cracks are there in infection, and then cellulitis, and then pus formation also. Do ankle exercise every hour for 5 minutes. So always advise this. So what you call चरतो चरता भगा, यानी जो चलता है उसी के साथ भाग्य संपदा भी चलती है. This is our Sanskrit saying. So प्रतिदिन 7 to 8 kilometers you should walk. Try to, and because it increases the blood flow, and that is the basis for saving the feet in diabetics. We are a poor nation and cannot afford huge spending on treatment of a foot ulcer and leg. Infection in diabetes which are preventable. A person with non-healing leg ulcer loses earning and self-esteem as well. Do not inflict more injury to an already traumatized person, and give him a proper advice at a proper time. That will be a great service to our society and nation. Thank you.
Thank you, Dr. Pandey, for giving a very... Any comments from Dr. Shastri, who is also a cardiothoracic surgeon and doing such surgeries, his colleague in Apollo Hospital?
Yes, Dr. Pandey, you presented the facts so well that each and every person, even an uneducated person also can understand this. and if they follow the instruction, as you said, I am sure he will be better benefited in the future.
Thank you, sir.
Very nice presentation, sir. How will you differentiate between the ischemic diabetic foot and, diabetic foot and ischemia due to the ischemia, gangrene?
I couldn't get it.
Whether diabetic foot, if there is a gangrene, whether it is due to diabetes, neuropathy, or it is due to the ischemic?
Because combined, both of them.
Why?
Because you have exposed your foot to the direct thing, and secondly, when there is a blood supply also,
Yeah.
they get accumulated and leads to gangrene.